Abnormal periods, that is what we are talking about today. Heavy, irregular, painful periods. Is that something that you experience any of this? We are joined by Dr. Kakuti. My name is Christine of Supermamas, where we are passionate about providing you with information so you can be an awesome mom, an awesome woman. And talking about awesome women, Dr. Kakuti.
Thank you.
Nice to have you.
Thank you. Thank you so much for inviting me back. I really appreciate Christine. Thank you.
No, it's always awesome to have you.
Yeah.
I had a conversation the other day with a good friend of mine, and she was telling me about her young daughter, that when she has her period, she has to be in bed those first 3-4 days. Painful, painful, painful. Our conversation today is, as I have mentioned, abnormal periods. So let's talk about, what do we start with? Let's start with
what's normal. Yes.
So what's considered normal periods?
Yes. So whenever a patient comes to me in my clinic, we were going to ask you about your periods. So don't be surprised. We're going to ask you about your periods. We're going to ask you about the flow, about your cycle. Now, thank God these days, if you have a smartphone, they have apps that you can actually I mean, when your period comes, you just
then you track.
So when I ask you questions about your period, just whip up your phone and show me. So I normally make fun of someone who comes to me. Yes, it's so new school. Before you used to have a calendar where you mark like this, and then you forget. So I mean, right now the phones have apps that will tell us whether your periods are okay. We look at your cycle, we look at your flow. So if someone comes to my office and they don't have the app, I normally do like, you should. So I mean, that's an amazing thing about technology. So the first thing I'll ask you is, when was your last period?
Do you know how often, like old mothers like me, when you come to see you, you ask, you ask us, when was your last period? I'm like, why does she need to know something like that?
I need to know.
Why?
I need to know because I want to establish if they're normal. So the first question I'll ask is, when was your last period? Now, if you tell me my periods are irregular, they're not very good, when was your last normal menstrual period?
Right.
Assuming you are getting them normally before. The next thing I'll ask you is, what is your cycle? Now, a normal cycle is counted from the day your period starts. That's day 1. Always remember that. The day. So most people say it came from 2026. The day it started is the date I want. That's the beginning of the cycle. Now, up to the next cycle, the next period, that is one cycle. And a normal cycle is between 21 and 35. So many women will tell me 7 days. I'm like, no, 7 days, probably she's talking about the flow.
Daktari, what's the difference between the flow and the cycle?
Okay.
I understood you when you said the flow is
amount of
the
bleeding.
amount.
So when someone tells me they're heavy, I need to quantify that flow. Yeah. And then now there's the number of days you bleed. So so let's go back. So I'll ask you, when was your last period? Give me the date it started.
And then you said that should be the day it started.
That's day
up
1
to
of your
the
cycle.
Day.
So up to the next period, not the upper when you bleed. So if in July it came on 20th and then it comes in August 18th, those days, I want to know how many those days. That is your cycle.
Right.
All right. And a normal cycle is between 21 to 35 days.
Okay.
So if you have a 21-day cycle, you might tell me, I got my period on 1st, then it came on 21st, I bled twice a month. Something is wrong. No. I'll ask you, show me your app. Give me a track of your period, and then I'll tell you whether it's a normal cycle or not. Others will have up to 35 days. The normal majority is somewhere between 24 and 28 days.
So that is what is considered to be normal cycle.
Yes, so between 21 and 35 is a normal cycle.
So let's go to what's considered to be abnormal.
So abnormal would be a cycle less than 21 days, a cycle more than 35 days. So you'll get a patient coming telling you, I'm staying for very long, I'm going for months without my period.
So that's not normal.
That's not normal. That's not normal. So if I'm going more than 35 days without a period, Dr. the last time I saw my period was in March. The first thing I'll suspect, whether you like it or not, is pregnancy. Oh, doc, I haven't had sex. You will do a pregnancy test. We must confirm that you're not pregnant, which is normally a fight with women because many assume.
I know myself.
You must do a pregnancy test. We rule out pregnancy. Once we rule out pregnancy, then we find out what is the problem. Now, if you have a shorter cycle of 21 days, we need to find out what's wrong. Now, the next thing we're going to ask you is, tell me the number of days you bleed. Now, the normal number of days of bleeding are 2 to 7 days. So someone come and tell
Somebody
you,
as short as 2.
as 2, another one as long as 7.
I would
1
love
week.
to be there.
I
like
would
2.
2 days and you're done. So 2 to 7 days is normal. So what happens with young girls? So if you're in school, your friend tells you, yeah, I'm done. Mine came 4 days and you're 7 days. So you think there's something wrong with you. So then last time we discussed about gynecological visit, your first visit as to the gynecologist.
Yeah.
These are things you're going to discuss and tell you what's normal. So
That's
when you're
wonderful.
getting 7, your friend is getting 4.
You shouldn't feel
exactly something is wrong. The other thing we discuss is the flow. So normally a normal period bleeding is about 80 mils of blood to about 100 mils of blood.
Right.
So we'll ask you, how many pads are you using on your heaviest day in 24 hours?
So the
flow, the amount of blood coming out.
Right. So the first abnormality we are talking about is heavy
Abnormal
flow.
cycle, abnormal flow.
Abnormal flow.
Yeah. So we have to establish. So if you tell me you're using more than 5 pads
A day.
in 24 hours on your heaviest day. So remember when you start your period, now people start periods very differently. There are those day 1, they start bleeding. And then day 1, day 2 is heavy. Then day 3 goes to day 4, it starts pungwang.
Right.
Others, they'll start with a small brownish discharge, and then the bleeding starts. So there's the heaviest day, and every woman has the heaviest day. So that day whereby you're going to wear enter a car with black seats. You do not want anything to Peter.
Nah.
So we ask you on that day, how many parts? So if you tell me I'm using 8, 10, that's abnormal.
A day.
A day.
That's a lot.
That's a lot.
That's a lot.
So we normally say between 5 to 6 per day on your heaviest in 24 hours. That's acceptable.
Okay.
Yes. All right. If you find yourself soiling yourself, then probably check, are you wearing the wrong type of underwear? I realize the type of underwear you wear can actually mess you up, and then you think maybe it's heavy, or wearing the wrong type of pad, the wrong length especially. So you need, I realize during your period, you may have to vary the type of pad you're using.
For the different days.
For the different days.
Right.
And it's okay to do that. Okay. So the flow is very important. So the cycle, the flow, the regularity of your periods.
Okay.
Sometimes I ask you, if your flow is normal, your days are normal, do you get a period every month? That's enough for me to establish you may have a regular period.
All right.
Yeah.
Just back on that point of abnormal flow, is it genetic? Or is it that something we eat?
No.
What's the cause? What causes it?
Yes. So if you have any menstrual abnormality, so there's a whole bunch of questions we're going to ask you. One, we'll ask you about abdominal pain. Are you cramping when you're having those periods? Are you on any medication? There are medications that can change your cycle and change your flow.
Really?
Contraception.
For life?
Yes. Not for life, no. Of course, we treat you. Yeah. Contraception is one question we ask. There are certain
important.
methods of contraception that will cause irregular bleeding and even heavy bleeding.
That's true.
So someone tells you, Kakuti had regular periods. Then you put for me the implant. You gave me Depo-Provera. Now it is 30 days. Alafu leo imemwaga nasikia toa inatoa clothes.
You know, speaking of which, I had friends of mine who swore that implants are the worst, that they were doing so well, but implants somehow, they're always spotting or irregular periods.
Yes.
No.
Yeah.
Is it that that there's some contraceptives that are just worse in making you have a heavier flow?
It will be a side effect. The thing about contraception, and I think that will be a topic for another day, is I can find you with your identical twin. And I give you the implant and you come and tell me, Daktari, thank you. Your sister comes, take this thing out.
Yeah.
Take it out, take
It's
it out,
true.
take it out. So one method can work very well for one person, another one. But one thing we know is different methods of contraception, especially progesterone, only can cause bleeding irregularities for some women. Others, they'll get no period at all during the time they're using it, and it's okay.
Is that a bad thing?
No,
That's okay.
It's okay.
That's okay.
It's okay.
Okay. So I shouldn't
so
worry
they'll ask
somebody.
me, yeah, where did my period go? Others say, please remove because I don't see my period. I'm like, you really want to see your period? But that's okay. You have to respect patient choices.
Yeah.
Whatever the patient wants. But always take your time to counsel them. Tell them, if you miss your period for 3 years and you're in the implant, it's okay. Haitengenez, you don't worry about it. But irregular bleeding, spotting, then bleeding, then whatever. Others, they get the regular period. So the thing is, when you come to me, I can't tell. Patients ask me, which is the best? We will discuss all the methods. You will make a choice. There are times I have to guide the patient into which one to use.
Okay.
But that's a topic for a different day.
Speaking of which, we've talked about heavy flow, heavy bleeding. Is there a way to stop it?
Yes.
What's the way to stop it?
So one, always find out the reason why. So one is you may be bleeding. Now the most common, the first differential diagnosis, I call it that. So bleeding has different, abnormal uterine bleeding, whereby it's heavy, has different causes. So you need to always, we say this, it could be 1, 2, 3, 4, 5 things. So that's called differential diagnosis. The first thing I'll always think about is, I'll ask you, are you on contraception? Then the next diagnosis is fibroids. Fibroids are a whole other topic. So fibroids are the most common cause of heavy bleeding.
Right.
So you have a mass in a growth in the uterus.
Okay.
So of course that increases the surface area from which you're bleeding in. So if you have the uterus is actually the size of it's actually smaller than the size of a fist. The first time I saw one, I was like, this thing is this small, and then it grows to that size and carries a baby. Amazing.
God is amazing.
God is amazing.
God's amazing.
So if you have a growth inside, especially the inside of the uterus, so it has increased the surface area, you find you're bleeding, and you tell me, when your periods are coming out, you don't feel them, but someone tells you, when I go to the bathroom, I hear, clots are falling, or when I'm having
Something is off.
so that can be that. Another problem can be endometrial hyperplasia, or you could be having hormonal imbalance, or there are many other causes that could cause heavy irregular bleeding. So when you investigate and find the cause, then you're able to offer appropriate treatment to the patient. Yes, it can stop.
And what I love about that is that people are walking around with heavy flows thinking it's normal and they're going to be like that for the rest of their lives. There's actually treatment available.
Yes, there's actually an option available. The other thing I noticed is someone tells me I have heavy periods. Then I ask them, have you gone to hospital to find out what's wrong? No, I have painful periods, so it's called dysmenorrhea. And they were told by their sisters and their friends, oh, that's normal. Exactly. You may actually have another reason causing painful periods. And the number one we normally worry about, especially from a young age, is endometriosis. That's a whole other topic. Endometriosis causes heavy painful periods. I've seen girls who are out of class for 2 days. I've seen women who are working who have to get a sick off
for the first few days.
Imagine your boss knowing
every month they have to give you, oh my gosh.
Imagine. So don't assume it's normal. There's a level of pain. Let me be the one to tell you, you have painful periods, and let me tell you, there's nothing I can find causing the pain. But if you have painful periods that are making you roll on the ground, you have a hot water bottle, you're on painkillers, you're on 3 painkillers, you can't even go anywhere, you're afraid, please go and seek treatment. One myth is people are told is it's normal. And even before I became a gynecologist, one thing I saw people, it's normal. Because I remember girls in school who used to have painful periods and they're in sick bay.
Same thing.
It is not normal. Let the doctor be the one to tell you, this period pain is expected, but please investigate.
You know what I love about this conversation is that it's important for the women who are listening to know that it's not normal. Even whatever they're going through, be it painful or heavy, that is treatment for that.
Here's the thing, Christine. Anything to do with our reproductive issues for women grew up being told it's normal, jikaze, jipambane nayo, it's okay. Instead, now we're saying, why should you? Why should you struggle with pain? Why should you struggle with heavy periods? Imagine being in someone's vehicle, going for a function, you've sat down,
so
your periods are heavy, and then
you're so self-conscious.
You're so self-conscious. There is help available. Find it.
Thank you for that. And for people who have young girls that every month they're coiling in their bedroom in pain, with a hot towel or hot
water bottle.
It shouldn't be acceptable. I know it is something they go through every month, but for us then to normalize it and say that the girls in this family go through that, I like that you've raised the question of endometriosis. We never talk about that.
Yeah. Endometriosis.
Our daughters, I'm sure, don't even know about that.
Don't even know about that. And it can be diagnosed. And of course, unfortunately for endometriosis, the gold standard to diagnose is surgical. You have to go in and look. But then if I suspect a young woman has endometriosis 14, the parents might not be comfortable subjecting to surgery. So I'll say, let me put her on treatment for endometriosis, see how she does. The parent comes and tells you, Tindi, thank you. And you find the girl is back to school, she's studying, she's normal, nobody's making fun of her, she's not being called names. So you find other girls, we used to make fun of girls who have pain and then on sick bay. I'm like, Kwanias guys don't get pain on Barbie. It is wrong. It is wrong. And this conversation needs to be had in schools.
I like that.
In schools. So if we also, and I kept saying this one thing I want to do, and I pray that God opens that door, is once schools open, we need to go to schools.
Have those conversations
when we were in school, I remember Johnson & Johnson came and gave us a talk and gave us pads and everything. I don't remember much of what they said. It was you're going to get periods, but things about pain, how do you take care of yourself? Hygiene.
Those are important, very
things
important.
Like hygiene. Do you keep, when a girl comes and tells me, I want to remove the hair and I have my periods, don't say, no. Give them the advice they want and they need.
Awesome, Dr.
Yes, we need to have these conversations.
Last thing, the last myth you need to bust before we leave. If I was to get pregnant and I used to have heavy periods or cramps, that pain, does it end once I get my babies?
That's a myth for some.
Is it?
So some people will get, so there are those who have painful periods and we can't find a reason. So one, we think that anatomically, so when you bleed from the uterus, it passes through the cervix into the vagina, then out.
Right.
Now the cervical canal can be very narrow. So what happens is blood accumulates in the uterus, just like when you have a baby in the uterus, and then the uterus is contracting. That's when they get the pain to push that blood out. So
Right.
we cannot surgically go and say we're going to widen your cervix to help the blood come out. No. So that one can be, we can't really manage that surgically, but can put them on painful periods. So the assumption is when they have a baby, because the baby passes through the cervix, the vagina, then the cervix widens a bit, that their pain will now be relieved, the period can pass easier.
Right.
Then again, it doesn't happen with everyone. So you need to always reassure patients, yes, some people, their pain will get relieved if they have a baby. Others, you have to tell them, I can't guarantee you that it will get relieved. So that's a myth, and that needs to be changed. If you're having heavy periods before, if there was something making you have heavy periods, you can have a baby and have fibroids and give birth even normally. But you still have the fibroids. So if your periods come back, they may actually come back normal. Then others, because they've had the baby at 6 weeks, to give you contraception, tells you, oh my God, whatever you give me actually is helping. Like Mirena. Mirena is a progesterone-laden IUCD you put inside. Oh my goodness, most people tell you, know what, don't even remove the fibroid because the symptoms are relieved. Wow. Not every fibroid has to be removed. 60% of us,
good to know.
many of us are carrying fibroids. Most people discover they've carried fibroids because they've done a scan, because they were pregnant, not because they had symptoms.
No.
And if you have an asymptomatic fibroid, what am I doing touching it?
I shouldn't.
Leave it
But you know,
alone.
that's when you become sick, yeah? Once you
Yes.
discover.
No, and you have to spend time counseling and reassuring your patient that nothing's going to happen to it.
Doctor,
Yeah.
we have to wind up this conversation. Heavy, painful, irregular periods, not a normal thing. Seek help. You don't need to walk around in pain. You know, for it to affect your productivity, reach out to a doctor, get help. Dr. Kakuti, if the ladies who are watching want to get in touch with you, I know, of course, they can subscribe and leave a comment. I'll be able to hook
Yes,
them up.
I think that would be better.
That would be good?
Yeah.
Yeah. So if you want to reach out to Daktari, please leave your comment. Please leave your, I think a comment will be good. And then I'll reach out to you and send you her number. Thank you so much for watching. And thank you, Daktari.
Thank you, Christine, as always. Such a pleasure.
No, this was very empowering.
Yeah.
Thank you for your time.
Thank you.